Half of the world's population lacks access to basic healthcare services, and Rotary is trying to help. Rotarians are involved in several efforts, including, but not limited to, fighting malaria, diabetes, multiple sclerosis, HIV/AIDS, and Alzheimer's, to setting up health clinics, dental and eye clinics, and training of health workers. Of the 26 Rotarian action groups that are in Rotary, 15 are dedicated to an aspect of healthcare. It is said that at any given time, there are hundreds of Rotary health projects underway around the globe. And that is certainly reflected by the amount, over $29 million in Rotary Foundation dollars, that were utilized for Rotary projects in just the last Rotary year alone, the highest amount of any of the areas of focus. This figure does not include our polio eradication program, where Rotary's contributions have exceeded $2 billion, including the matching funds from the Bill and Melinda Gates Foundation. Rotary's polio program, our major corporate program, is where I have focused my Rotary service, because for me, the eradication of polio is personal. My journey with polio began at the tender age of 17 months in South Berwick, Maine, USA, when the polio virus attacked my body. It was just 3 months after our very first polio vaccine was released to the public. I was initially paralyzed from the waist down that lasted for several months. After multiple surgeries, leg braces, and countless hours of physical therapy, and I love physical therapists, I have been able to live a relatively normal life. And although I do have residual damage to my body, and I face daily challenges, I feel truly blessed to be standing here in front of you today. Thank you. Thank you. So it was only natural that when I learned about Rotary's initiative to eradicate polio, that I should become involved. So I traveled to India on my very first NID, or National Immunization Day campaign, in January of 2001, before I joined Rotary. And I witnessed firsthand the devastation that polio was still bringing to the people of India. I saw crawlers, young and old, begging in the streets, dragging themselves by their hands and their arms, their legs twisted in unimaginable contortions. Some actually wearing sandals on both their hands and their feet, walking on all fours like animals, stripped of their dignity. I was shocked and saddened, and I soon realized how fortunate I was to have had polio in the United States and not in the slums of India. And on this very first trip, my team visited a rehabilitation center. As is customary at these clinics, when visitors arrive, they want to show the good work that they do. And on this occasion, they brought in a group of school children, all polio survivors, all with assistive devices of one sort or another. And there was a particular young girl, about the age of 9, who caught my eye as she slowly limped past me. She had the most beautiful smile, and I can still see her today. As I returned her smile, I looked down at her legs showing beneath her dress. And there I saw the same thin right leg, the same heavy metal brace, and in an instant, I was overcome with memories of myself at her age. As I looked back up at her face with tears streaming down my cheeks, she smiled at me again, seeming to understand my personal pain. I cried for her, I cried for me, I cried for all the senseless waste that polio has brought to so many for so long. A polio survivor himself, I could hear my Uncle Marlon's words as I left home to make this first journey, telling me that if I could prevent just one child from getting the crippling effects of polio, I will have done my job. At that moment, shared with this little girl, I knew I had to do whatever I could to protect more children against this dreadful crippler. Since that first trip, I have organized and led volunteer teams to participate in polio immunization campaigns to over 9 countries, completing my 29th trip just 8 weeks ago. Thank you. These trips have exposed me to the many needs existing in the developing countries, including thousands of polio survivors and the challenges they face. This has led to projects to provide mobility to those left crawling on the ground with the gifts of tricycle wheelchairs. And although I have presented these to many, it is always an emotional experience for me. Just for a moment, I want you to imagine a woman covered with the dust of the streets, her hands and her knees thickly calloused from dragging herself around, reaching up and pulling herself onto the seat of that wheelchair, reaching down and lifting first that one limp leg and putting it up, and then reaching down for the second, and then placing her hands on the pedals, and at last moving herself forward. For the first time, she is mobile, off the ground, her dignity restored. Thank you. And there is a smile on her face like no other. And that smile continues to motivate me to do more. On my first trip to Nigeria, I immunized in a village far from town. And I met a girl, an 11-year-old girl, Uma, a polio survivor. The closest school was miles away, and it was a challenge for the village children to attend, and an impossibility for Uma. This led to repeated meetings with the governor of Kaduna State for a school to be built, and demonstrated to me firsthand the power of Rotarian advocacy. This was followed up with a project for 2 wells with solar-powered pumps and the building of a toilet block, followed by the building of a bridge to provide access to healthcare and commerce, even during their rainy season. And I will never forget the village chief thanking me, saying, "You have taken our children out of the darkness and into the light." I've also immunized in Mali at a home where the mother was pregnant and she had 5 other children. I spent some time holding the youngest, not yet 2. We left the home and walked down the hill when suddenly I heard my name. And turning around, I saw the pregnant woman we had just left running towards me with the little boy in her arms. And she held him out to me, begging me to take him, thinking I would have the opportunity to offer him a better life. She wanted me to have her son. She would have another child within weeks. It was heartbreaking and very emotional, and it turned out to be the first of many times a mother would offer a child for me to adopt. It became easier to understand when I learned that in Mali, parents do not name their children until after they are a year old, realizing that many die before they reach the age of 1. At the time I was there, 172 children out of every 1,000 died before the age of 5, many from preventable diseases, a very sobering statistic. Today, thankfully, that rate is better, but still needs improvement. And on my most recent trip, the team raised funds to purchase 3,000 bed nets for the families that we immunized where malaria is a constant. Little did I know that I would soon feel the effects of malaria of myself and realize the importance of what we were doing even greater. We also visited camps filled with displaced persons due to the Boko Haram terrorist attacks. We listened to their stories and we gave them food supplies. These stories, I hope, show you how Rotary's areas of focus are intertwined. To me, the stories I have told also demonstrate the plus in our polio program. NID volunteers seeing and taking action to address other needs. Our polio program has immunized over 2.5 billion children, and we've reduced polio cases by 99.9%, with only 3 endemic countries remaining. Over 17 million people are walking today who would have otherwise been paralyzed or died. And more than 650,000 cases of paralytic polio are now prevented every year. The polio program has done all of that and so much more. You see, the plus in Polio Plus has supported protection for children against all vaccine-preventable diseases. For routine immunization is the basis for strong healthcare platforms in countries needed to ensure a polio-free world. The eradication program has invested in developing a cold chain for storage of vaccines, facilities I've seen in my travels, for the training of healthcare workers, and we've developed an essential surveillance system to track the polio virus. But there are still gaps in public understanding and acceptance of the benefits of immunization. And here is yet another place where Rotarians can play a role with education, social mobilization, and advocacy. Perhaps even one of you can play a role. So despite the world reporting the lowest number of polio cases ever, our job is not yet finished. For as long as polio continues to exist anywhere in the world, there will continue to be polio survivors. And the crippling effects of polio will continue to take its toll on individuals, families, and communities. My Uncle Marlon spent the last 10 years of his life as a quadriplegic, living in a nursing home, unable to even feed himself, all due to a condition called post-polio syndrome. And I, and thousands of others, live with this fear of incapacity and isolation every day. As a person with polio, I remain committed to this cause, and I ask you to join me. Every step that I take is my reminder why we must end polio. Every child you know, every child you see, should be your reminder. I immunized in a nursery filled with 4-year-olds in Abuja, Nigeria. And the teacher had the children sit down on the benches that were lined this little room. As I began to place the polio drops into the mouths of each child, I suddenly felt a tug on my pant leg and looked down to see a little boy. The teacher quickly returned him to his seat, and I continued. Shortly after, I once again felt a little tug on my pant leg. "No, no," said the teacher, "it is not yet your turn," and set him back down. When I finally came to him, he looked up at me with those serious dark eyes, and he said, "Auntie, I love you." Yeah, that's how I felt too. That was the most memorable thank you ever. And I share this story because I believe it was a thank you to Rotary. It's a thank you to all of us. And in closing, I'm reminded of a saying that states that the longest distance we have to travel is the connection between our head and our heart. Because when our emotions, those feelings of being valuable, of being competent, and of being joyful, begin to resonate with our belief in service above self, then you become passionate. And when you are passionate, you are powerful enough to move from hesitation to action. So I ask you, will you put your passion to action? I urge you to take that first step. And I'm not asking you to do what I do. I'm simply asking you to do something. As President Ian has said, in Rotary, you are not just one person. We are a team, and together we can do more. So please, share your passion, be the inspiration, and touch a life. Thank you.